Or if they are already on menopause hormonal therapy, can they carry on? My name is Nelum Dharmapriya. I'm a GP with Whole Food Revolution. And this is a frequently asked question. And I think it's something that we should unpack because there are so many myths surrounding menopause hormonal therapy and women as we get older. So, menopause hormonal therapy has been around for many years, for 50 years. But in the early 2000s, there was a study published, the Women's Health Initiative, which which really terrified clinicians and patients because it said that menopause hormonal therapy was likely to increase the risk of breast cancer, heart disease, strokes, and other clotting disorders. And there were several generations, probably 2 or 3 generations of women that then decided they weren't going to have this. And in my, in terms of being a GP, I was always taught that, you did not start women over the age of 60 on menopause hormonal therapy, or MHT. I'll use that for ease. But that is not the case. There's now emerging evidence to say that MHT, the current body identical, newer options, are really safe and that it can be used in women over 60. So let's just go over this and talk about it a little. So, what's different from the older generations of hormone replacement therapy? So what we have now is what we call body identical MHT. So these are chemically exactly the same. So the estrogen, progesterone, and testosterone exactly the same as the hormones that we produce in our body. So they're body identical. They are also applied in different ways, particularly the estrogen, the estradiol, goes through the skin, either in a patch or a gel form. So because it goes through the skin, it goes through the skin into the blood. It doesn't go through the liver. Not going through the liver means it doesn't impact clotting, because that's what affects clotting when it goes through the liver. And that's why it doesn't have those effects on heart, stroke, clotting, other clotting disorders. So that's a real positive. And it is true that if the women who get the most benefit are those who are 10 years, usually they're 10 years after going through menopause or before the age of 60, is generally the idea. And particularly for the cardiovascular benefits, it's in that woman before the age of 60. But over the age of 60, there is no increase in cardiovascular problems. There just isn't any, that added protection isn't as significant as if you started it earlier. But there's still the brain protection and the bone protection, which is really important for women over 60. So really, and the other thing is, a lot of women, particularly from the late 50s onwards, when I ask women about menopausal symptoms, they say, oh, no, I don't have any menopausal symptoms. Are you sure though? Because the problem is that we've been in this state for so long. How do you know whether, you could be better? Because you might not have hot flushes and night sweats, but what about things like poor sleep, brain fog, difficulty concentrating, motivation, anxiety, feeling overwhelmed, aches and pains, fatigue, frozen shoulders, injuries, plantar fasciitis, vaginal dryness, lack of libido, recurrent urine infections, skin, dry, itchy skin. So many of these are all menopausal symptoms, and there's many more. So I think a lot of women in their 60s still have some symptoms, and I think it's worth going and having a chat with your GP about this. So it is and then the other thing was, I always thought that, hmm, isn't menopause a natural phenomenon? Don't all women go through it at some point in their lives? And what's the big deal? Women throughout thousands and thousands of years have gone through menopause. They didn't need menopause hormonal therapy. But what I didn't realize until recently is that even as recently as 200 years ago, women didn't live beyond, a lot of women didn't live beyond 50, beyond menopause. And now, if you take Australia and the life expectancy of women today, it is 87. So women in their 50s and 60s now will probably live into their early 90s. So that's a massive chunk of life in that postmenopausal state. And what has also been found is that every single organ in the body has estrogen receptors. So, that means that for a chunk of our life, we are functioning suboptimally because we don't have the estrogen to work these receptors anymore. So I think that's something to think about, and it's really about quality of life, and also not just, actually, it's not just quality of life. It's also looking at the the health span, not just lifespan, making sure that the period of time that you are alive, you are spending in good health, because we know that once women become menopausal, there's twice the risk of heart disease, twice the risk of diabetes type 2. By 65, we are four times have a 4 times higher risk than men of developing chronic disease and disability. We lose 25% of our bone density within the 5 years that we go through, usually 5 years after menopause. So, and we know that there's such a high risk of osteoporosis in postmenopausal women. 1 in 2 will have an osteoporotic fracture. And the most common cause of death in women is dementia. And women have twice the rate of dementia than men. So, these are all significant issues. And I think if menopause hormonal therapy can help keep women well and functional and optimized, why not? So it needs to be taken on an individual basis. There are actually very few conditions where women can't have menopause hormonal therapy. They need to be started at lower doses, and we go slow with the women over 60. But the side effects of these body identical hormones are very few, and I think it's worth considering this option. Even if you're a woman in your 60s, give it a trial for 6 months, see how you feel, because even very low doses of the estradiol, what you apply on on the skin, the estrogen, the body identical estrogen, has been shown to have significant impact on bone health. And now I do a lot of bone mineral density scans on my women, or I get a lot of my women to do these, and I'm finding a significant proportion have either osteoporosis or osteopenia, which is lower bone mass. So find a doctor who is versed in menopause hormonal therapy, who understands that it is safe in women over 60, and have that conversation. I think it's worth giving it a try. So if you enjoyed this video, then please like, subscribe, and share. Bye.